All right, well, welcome everyone. My name is Danny Rubin. I'm the founder of Reuben. We're a provider of online resources for business communication skills. Teachers who are at your Zoom controls, raise your Zoom hands if your students send you emails that look like text messages. Any hands for that? I see some hands. So we help young adults become more confident and professional in how they communicate, writing, as they speak to people. That's the Reuben Company. And we're excited to have you all here today for our next installment in our virtual internship series, all about the world of medical careers. We have two great guests today, Dr. Ryan Williams and Mr. Travis Fermil, a doctor and a nurse, respectively. And they're going to talk about what they do every day to give students an inside look at the occupations. We'll get to them in just a moment. We also have a sign language interpreter, Miss Amber Caldwell. We appreciate her being here. And my teammate, Mac Dowd. She is our implementation specialist at the Reuben team, helping schools use our online instruction. And what I'll do, Mac, you can hang out in the chat and flip off your camera. I'm going to start by offering some resources to the instructors here. We always start with resources for the classroom, okay? And then we will get into our conversation with our guests. So our guests, just hang tight for 1 second. I'm going to share my screen and pull up a PowerPoint. Hopefully everybody can see my PowerPoint, okay? For those who do not have this set of resources, if you're new to our community, we'd love to give it out right now. We have provided a Google Drive folder for free of lessons for email etiquette, how to create a professional email address, how to not send emails like texts, how to write a subject line. If your students are sending you the entire message in the subject line, let's correct that behavior. How to address teachers and employers, how to create an email signature, and more. If you would like these resources, hang tight, I'll explain how to get it. We also put together, and we like to give this out to, an online presentation checklist. Raise your hand, teachers, if your students will be doing virtual presentations at some point this year. So this is a one-page virtual presentation checklist on best practices for delivering presentations. So if you would like the email etiquette exercises and this online checklist, here's all you have to do. Go to the chat right now, type the word interested and your email address. And those who are new to our community, what we always prefer to do is have a 5-minute phone call with you to learn about your specific health science class or CTE class, whatever it is you're teaching, help you make the most of these resources and use them. There's no cost to these resources. We want you to have them, but we'd like to have that quick hello, pass it along, let you make the most of it the rest of this year, and to share these resources with your team, to make it a tool that you can use throughout your building, throughout your department. Let's help all students learn to write emails professionally. We'll talk to our guests about that and how our guests would perceive young people who send text-looking emails, how that might impact opportunities that may come their way. So thank you to everyone putting their information. You can continue to do that. I'm going to move through our last couple of slides so we can get to our guests, okay? So thank you to those who have requested it. We'll mention it again at the very end for those who come in just a few minutes late. Now, we also, our virtual internship series keeps on rolling. We have a really fun guest coming up in 2 weeks. On October 5th, we're going to explore the world of being a chef, working in restaurants, the world of culinary. Our gentleman, our guest will be Jared Bobkin, an executive chef in Michigan, and he's been on Hell's Kitchen with Gordon Ramsay twice. Has anybody watched that show? Hands up if you've ever watched the show with Gordon Ramsay yelling at people in the kitchen. Any culinary students or culinary classes here? Or please share this with your culinary teachers, okay? So please, when you see that link come out to register for that session through your email, please sign up or pass it on to the appropriate person, okay? Last couple of things. If you're watching this on a recording, and many of you, not here right now, but many have asked about this, and you'd still like our email etiquette resources, send us an email to this address here, support@reubeneducation.com, and use the subject line Reuben email worksheets, and we'll get it to you that way. Finally, everyone here today who's here with us live is going to receive, oops, sorry, that's the wrong certificate, you'll get the one for today, medical careers. The medical careers certificate, it'll come to you tomorrow in your email. So just the chef one is in 2 weeks, medical careers tomorrow. So you'll get a certificate for being here. Teachers and students, use it however you need it to show that you were here with us today. Okay. So with that, I'm going to hop out and I want to bring in our special guest. So Mr. Fermil, you can flip on your mic again. Okay. And I want them to both first introduce themselves to us, and then we'll have some questions for them. Let me start with Dr. Ryan Williams. Appreciate his time. He's in the middle of his workday. He's on call. His phone might be buzzing. He's gracious enough to give us his time. So let's start off and give us your quick background and the work you do in a children's hospital.
Yeah. So I'm Dr. Ryan Williams. I am a pediatric neurologist, which means that I help with medical problems of the nervous system. So the brain, the spinal cord, muscles, nerves, all that stuff. Okay. And specifically, I do a lot of headache medicine. And so I take care of a lot of patients with migraines and other headache conditions.
Wonderful. Thank you very much. And Mr. Fermil, go ahead with your background.
Hello, my name is Travis Fermil. I'm a registered nurse at Norfolk General in the emergency department. I'm one of the charge nurses there, and it's a level 1 trauma center, so a real busy emergency department. We see somewhere around 250 to 300 patients a day through the ER. And wow. The roles change. There's a lot of different nursing roles in the emergency department. So every day is completely different.
Wow. The students, if we really want to learn to listen closely for details, did you hear a number of how many patients his emergency room sees a day? What was that number he just gave us? Can you tell me in the chat? What was the number? Numbers matter. Numbers help us understand how much, how many, how significant something is, right? Thank you for putting the number in the chat. Remember, for your own resumes, your own applications, what numbers do you have? How many people do you help? How much money have you raised? How many of something do you possess? Remember your numbers. Now, one thing that I asked you to do when we passed out this worksheet ahead of time, and if you don't have it, that's okay. You can still get some main points from the conversation in your own Word doc or Google Doc. But one thing that we asked you to do is to look up our guests. And we provided links to our guests on their website bios. Dr. Williams has a bio on the Children's Hospital of the King's Daughters. That's where he works. CHKD is the abbreviation. And so I had a question about it. He spoke to it just a little bit because I was reading through his bio and I came all the way to the end and it says research area pediatric headaches. So let me first pose a question, Dr. Williams. What interests you so much about headaches? Why are you drawn to that topic in medicine?
So it's a very interesting question, a good question. I certainly never imagined myself as a pediatric headache specialist, but it is something that I feel that you can really help kids with. So, I always say to, parents and children that, migraines, which are the most common type of headache disorder, and certainly the most common thing that I see in my clinics, they don't kill you, but they make life miserable. And so you can make a child's life much better by helping them with their headaches. And that's very rewarding.
Thank you very much for that answer. We'll get into more of your work in a few moments. I also went to the LinkedIn page for Mr. Fermil and surprise Mr. Fermil, but look, it's out there, right? Your information. And I noticed that he won a Nurse Excellence Award. So I was curious, what did you do to earn that award? Do you remember?
So, yeah, I do. So that was my first year of nursing. So every year, the company I work for, Centera, hands out these awards for certain individuals, and I won the award for the new grads. And you basically are recognized by somebody in your department. Mine was my manager at the time, and they write a little bit of a biography or just talk a little bit about what you do, and then there's a panel of judges who make a decision on who is going to win the excellence awards, essentially.
Love it. Love it. Thank you for that. Dr. Williams, what would it mean to you if somebody who came to be an intern or to be a resident or someone who worked under you and they're interviewing with you and they walk in the room and they already know about your bio, at your interests is headaches, they've already read about you, studied you. What does that say to you as you view that applicant that you may have just met for the first time?
Yeah, that says a lot of positive things. I mean, it tells me that the person is motivated, the person is interested in, what I do. They're interested in showing that they are someone that is a go-getter and somebody who is going to be someone who is motivated to make a difference.
Wonderful, wonderful. And students, raise your hand if you think that you could Google the person's name, find their website bio, read about them for 5 minutes, and come in the room with some questions about their background. Could you do that? Could anybody watching do that? So it's not a complicated task. It's not just for the gifted and talented students. It's not just for anyone could do what we just did, right? And it can change the whole dimension of that conversation. It makes you much more hireable if you learn to think about other people too. Now, what I want you all to do is please go to the Q&A in Zoom, and I want you to start putting your questions for either one of our guests. Please put your name and your school so we can give you proper credit. And as you do that, I want to help the educators here understand for 30 seconds our company and the themes that we address as the questions fill up, and we'll pick some good ones to ask. So again, our company is Reuben. Our curriculum is called Emerge, and we cover a variety of real life communication skills, email etiquette, life skills, phone and video etiquette skills, like talking into the phone, networking, resumes and cover letters, how to write emails for internships and jobs, how to write a LinkedIn profile, how to prepare for job interviews. We cover entrepreneurship communication, sales writing, website writing, PR, fundraising pitches, and leadership communication, writing as a manager, writing to your clients, writing to your team, public speaking, report writing, leadership communication. Let me hop out of here. And I want to ask the group, as you put your questions in, do we have any student organizations here? Is HOSA in the building? Any other CTSO, student council? Tell us in the chat. There, I told you there's a lot of HOSA, 4-H, student government. Told you there's a lot of HOSA folks. Mr. Fermil, were you familiar with HOSA? The Health Science Student Organization. It's all over the country. A lot of HOSA today. That's right. So a lot of students and organizations. Go ahead. I'm sorry.
I just wanted to add something to what you said earlier that I found a large impact in my career thus far, and that's especially with the healthcare field, all of these healthcare systems have a specific motto, and it's very evident on their websites what each specific healthcare system's motto is. For instance, one will be like treat patients like you would want your family members to be treated, or someone's motto might be Centera's is improving healthcare every day. And I've found in my interview processes in the past that it was super simple to just look up the hospital's motto and have that as a starting point or an icebreaker, or just to chime in at some point during the interview. And it makes a big difference because the person interviewing you recognizes that you've done some amount of research. And I looked it up in the parking lot before I walked into the interview. So.
Right, exactly. You can do it as you walk in the door. You got a cell phone, you got internet, there's no excuse, right? First of all, you're all putting questions in the chat. Great questions, but the chat goes really fast. You have to take these questions and put them in the Q&A along the bottom, okay? Please put them in the Q&A or we can't ask them. It goes too fast. So Q&A and we can go through. I'm going to sift through questions while our guests answer this first question. So Dr. Williams, take us through your day. What does it look like? What are you doing? Paint a picture for us. Help us understand what you do.
Sure. So I have two types of days. So I have my days when I'm in my outpatient clinic. Okay. And then I have days where I'm in the hospital like I am today. On days that I'm in my outpatient clinic, I start seeing patients around 8 o'clock, and I am just seeing outpatients throughout the day. I have about an hour or so in the middle of the day for lunch, and then I'm seeing them from 8 till about 4 every day. And so it's a mixture of, new patients and follow-up patients, I do injections for different headache condition, for different headache managements, doing those kinds of things. And then, I see other patients as well, seizure patients, and other things as well, but certainly mostly headache.
Thank you very much.
And then,
Go ahead.
Oh, I was just going to say, on the hospital days, those are different.
Okay,
And so on
go ahead.
hospital days, I come in and I see patients that are here in the hospital that are either being primarily taken care of by me as a neurologist, or by other teams in the hospital who need a neurologist involved. Then on days I'm in the hospital, I also do EEG readings. And so an electroencephalogram, which is essentially looking at brain waves. And so I will look at people's brain waves for, several hours every day, and do that as well.
Wow. Thank you very much for that. Mr. Fermil, tell us about your day in the ER, probably a little different. Dr. Williams, maybe tell us about that.
Sure. So for me, I work permanent weekends. So on Fridays, I'm usually in the trauma assignment or in the psych pod. So in the emergency department, there's some days you might be triaging patients. Some days you might be the trauma nurse. Some days you might be in the mental health or the psychiatric pod. And then some days you're in charge. Well, I'm in charge of the department. There's a few of us that are charge nurses, but essentially you come on to the shift, you meet with whoever the night shift nurse was, their 12-hour shift. So I do 7 a to 7 p.m. or 7:30, or sometimes when it's busy a little later. And you get report on your patients. Typically you go into the rooms, kind of talk about the patients with them, discuss their plan of care and what's going on with them, and then start your day. And it's basically building tasks lists of things that need to be done for people, drawing blood work, EKGs, getting them to and from CAT scan, titrating critical medicine drips and such. And then it just builds up from the day shift. It gets busier and busier. It's pretty chaotic.
Wow. Thank you for that. We have a lot of questions now. As we were talking, they're filling up. We'll do our best to get to several of them. Several people are asking a similar question. I want to start with this. We have Zion Mason from KIPP, Baltimore. Also, Kimberly George asked a similar question. They want to know, how many years did you attend school? Let's start with Dr. Williams. I know you were looking at your bio, you were at Stanford, you were at various places, you've been in school, you went a lot of school. Tell us the path to where you are now.
Yeah, so I spent 16 years after high school doing additional education. 16 years after high school.
Remember that number, everybody. Go ahead. So tell us, that's a lot of time, but tell us the spots along the 16.
So after I graduated from college from Northwestern University, I went to Stanford Medical School and did my 2 preclinical years there. And then I did a year of research, and I did a year of a PhD. And then I went to Harvard for a year and did a master's degree there. And then I came back and finished med school. And then after that, it was 5 years of additional training to be a pediatric neurologist.
Wow. Several schools, a lot of training in different places. It really, if you want to be a specialty in medicine, there's so much. And I have a good friend who's a pediatric heart specialist, and he just seemed to always have another place to go, another round of residency or another. 100%. That's it. Wow. So Mr. Fermil, tell us about your educational journey.
Sure. Well, I'm somewhat of a long hauler for education. I think I've been in school now for 14 years since I was in high school, and I just continue to keep going back. For some reason, I feel like I'll be in med school in my 40s, but time will tell. So to become a registered nurse, though, there's quicker ways than I did it. You basically can go straight through an associate's to another associate's degree. So in 4 years, you can come out with your nursing license or sit for the boards for nursing. So quickest is 4 years. There's also accelerated post-bac programs for people who want to go, who may have done like biology or any other bachelor's degree that then want to go back to be a nurse. So there's several ways you can do it, but quickest is right around 4 years.
Okay, that's very helpful. Thank you for that. We have a question that I'd like for you both to answer. From James Hatter, and I don't know where you attend school, Mr. Hatter, but thank you for the question. How has COVID changed the way you work every day? Start with Mr. Fermil this time. How has COVID impacted your day-to-day? It's probably a very broad question. Let's just focus now on like how you sort of monitor yourself or how you go about doing the things you used to do. How has that changed?
Sure. Well, this is an hour-long discussion.
Right,
I'll
I know.
squeeze it
It's a
into
big
a minute or two answer
yeah.
if I could.
Yeah.
The first COVID patient that we had, I was the triage nurse who triaged him, who came through Wuhan and flew back to the States. And it was right before it was even here. And it was terrifying. And we wore these giant papper masks, like something you would see from ET, and these huge hazmat suits. But since then, it has dwindled significantly. I think the biggest effect that it's had on us and my department is the PPE that we wear. Essentially, I'm wearing an N95 mask for 12 hours, which is, I don't know if anyone out there has ever worn one of those before, but it's not a normal surgical mask or a cloth mask. It fits to your face, and it's hard to breathe sometimes when you're moving and grooving and trying to run around, and it gets busy. And then you're wearing eye protection, and I wear a head covering as well. And then sometimes you're still gowning up for this, that, and the other too. So the PPE has changed a lot. That's the personal protective equipment. I guess I should explain that.
Yep.
But it has definitely been a burden. People are burned out. It's been very, very busy, and people are much sicker, I think, than they were before COVID started. So, and I've seen a lot of nurses leave and go traveling because the money's greater in the travel assignments and what have not. So it's ever changing.
You know, I want to ask this to Dr. Williams, but before I do that, I want to just do one thing. You know, he said that there's a lot of burnout right now. Morale may be low. Health professionals have been at this for many, many months. And so I just want to do what's called a follow-up question. Okay. So you have a lot of students watching today who are interested in becoming a nurse, working in the field. What would you say to them? You know, they're still wide-eyed, bushy-tailed, optimistic. Would you say, please still come in? We need good people. We need your energy. We need your enthusiasm, even though right now it's at a low point. What would you say to those young people who are thinking about it today?
Well, I guess I would start by saying that, you know, it's all a perception. And if you're coming into the field at this low point or in the next couple of years, you're going to be starting your career at this point. So perhaps it'll just get better and you'll be surprised.
Like that answer.
But if you know, but I think the burnout was occurring before. Healthcare is a difficult entity in itself with a lot of political input and regulations, and a lot. The good part about it is that there's, at least from a nursing perspective, there's so many places to go. If you get burned out in the emergency department, you can go to the post anesthesia care unit where you just wake people up from surgery, and it might not be quite as daunting, and you might not be wearing the same PPE, or you can do home health, and there's just so many different things you can do if you feel like you're overwhelmed in your spot.
Thank you for that. And how many students have ever asked a follow-up question before? You listen to something, it interests you, and you want to ask more. That's a great skill, a great trait to show that you're really listening and thinking, and you want to go deeper in the conversation. Never be afraid to ask a follow-up question. Dr. Williams, how has COVID changed your work?
Well, I mean, I think the biggest thing is, you know, echoing what Travis was saying, is that, you know, it's we're wearing masks all the time, and you know, I don't see my patients' faces. So, I mean, I was remarking to somebody yesterday that I think there are patients that I've started seeing over the last year and a half who I've never seen their face except for the first time I examined them to, you know, have them bring down their mask so I could see their face. And I think there are people that have met me as their physician who have never seen my face. And
Yeah,
so
true.
that's a weird thing in medicine, because facial expressions and are so much of what we use to communicate, especially between physicians and their patients. And so that's been strange, and we're all still getting adjusted to that.
It's a great answer. Question for Mr. Fermil from Laura Vendries. What's the difference between a triage nurse and a trauma nurse?
Good question. So when you walk in the front door of the emergency department and you're in the waiting room, you're going to meet a nurse, and that would be me. And my job is to say, what are you here for? What is your history? What kind of medical problems do you have? What are your vital signs right now? Is your heart rate high? Do you have a fever? And then I kind of do a once over, and you get really good at looking at people and saying, are they sick or are they not sick? And then you take that information, and within 45 seconds, you make a decision on where they're going to go to in the department. Are they going to go back straight to one of the critical bays where they need physician attention immediately? Or are they more of an urgent care style patient who just has an ache or sprain that we can try to get in and out of the department in a quick amount of time with a little amount of resources?
Thank you very much for that answer. We have a question from Grishma Parmar. I believe it's Mission Valley ROP in California, for Dr. Williams. How do you motivate yourself to work so consistently, to go through all the schooling, to just keep grinding it out every phase? What is your work ethic? What is your regimen? How do you do it?
Well, I mean, I think that's a really good question. Looking back, when I had to push myself all the time, I just had a goal. I knew what I wanted to do, and I knew that the steps were this, this, and this. And so I just pushed through. Looking back on that, as after it's over, you look and you marvel and you think, oh my gosh, I did that. And it's a little, intense. But you just have to have a goal, and then you push towards the goal. You always know that that's sort of where you're going. At the same time, you do want to be open to opportunities and, do other things if, circumstances arise that, you need to take advantage of a different opportunity. And I think that that's very important as well, which is why sort of my education career has kind of gone a little bit like this, is because I took advantage of other opportunities when they arose. And I think that's really important. But at the same time, you have a goal and you want to get there.
So what you're saying is there's no straight path. There's no one, there's going to be a lot of twists and turns, right? There's no
100%.
A to B directly. There's going to be some veer offs but that's
100%.
part of the journey, right? That's part of the ride.
100%. Yes, definitely.
I want to get as many student names as I can. Maria Jose Ramirez Cobar also asked about the COVID question from Temescal Canyon High School. We have a question from Kristen Bueller, Irvington High School, also in California. I'm going to paraphrase her question a little bit. I think I know what she's getting at. I'll start with Dr. Williams here. If you're in middle school, high school, even college right now, what classes should you be taking? What should you be focusing on to prepare yourself for working in medicine?
Honestly, the best classes that you can take are classes where you will learn a lot of things. And so you don't need to pigeonhole yourself into only taking science classes and only hard science classes. You want to take hard English classes. You want to take hard history classes. You want to know how to learn. You want to be able to approach learning. And that is a skill. And that's a skill you need in order to be successful in the medical career. Again, even if it's, approaching studying, ancient, Egypt, you're still, approaching that in a way that you will use those skills to approach medicine in the future.
Well, okay, here's another follow-up question. What does it mean to learn how to learn? What does that mean? Tell us, like, when you learn something, what does that actually mean? Does it mean you memorized it? So it's just like top of mind because you memorized the words, or how do you really internalize knowledge?
You really have to, it's not just memorization. It's using that information and understanding where that information came from. And so it's understanding that, this is what calculus is, for example, or it's understanding the process. It's not just rearranging numbers on a page. It really is understanding where these things come from, and then you can take those skills and translate them into other areas.
Ah, love it. Thank you. Mr. Fermil, what would you recommend to students who want to go down your path, have a nursing career in various places where nurses can work, but what would you direct them to learn while they're in school? Oh, there you go.
Can you hear me? It
Go
looks
ahead.
like I'm freezing. Okay, here we go. I think one of the things that always comes back for me that plays a big role, and I'm sure Dr. Williams as well, any psychology classes that you could potentially take, social psychology, abnormal psychology, general psych. I think psychology classes can, one, teach you a lot, but two, it teaches you how to interact with people, and in a way that in the back of your mind, some things from those classes will always pop up. Like, for instance, when you're taking care of critically ill patients and they're in a really vulnerable time and they're alone in the hospital because there's no visitors allowed and they might be dying, even having that psychology background and just kind of understanding the way people think helps you interact with them.
Wow.
I mean, I agree
Please, go
100%. I mean, I majored in psychology.
There you go. There you go. Having that, as they say, that bedside manner, is that appropriate to say that?
Yeah.
Knowing how to engage with people even beyond the medicine, just person to person, matters a tremendous amount. Question for Dr. Williams from K. Russell. Is it hard working with sick children?
So it can be difficult working with sick children. I think the thing that you learn in pediatrics is that a lot of sick children get better. And so that's a difference in adult care and in pediatrics. So a lot of sick children get better. Even sometimes when we don't know what's going on with them, they get better. And, that is very rewarding. It's very exciting to watch a child who, just had a stroke, for example, and watch him and see him a year later and go, wow, he can do pretty much everything now that before he couldn't use his right arm. And so it's pretty impressive.
That's great. A question I'll pose to Mr. Fermil from Nicole Alvarado, Victor Valley High School. She's saying, what was your best learning experience in the field? I'll ask it, and is there a particular patient or experience that you remember where there was a happy ending, your efforts made a difference, you could see a change or helping someone to become better? Does any one memory or moment stand out to you in your career so far?
I think that the most memorable thing that from this experience to date is being there for the family members. Sometimes it's hardest for people to see their loved ones in these terrible situations that may have come up with no not knowing that they're actually going to happen, especially in the emergency department. Car accidents, traumatic events, strokes, heart attacks, things like that family members might not have been known that their loved ones were going to go through. And just being there sometimes, like, I have cried with a lot of families and rubbed a shoulder or passed some tissues or something, or just sat there in silence. And any of those moments where you can feel the appreciation without words is overwhelming and probably the most impressionable.
Wow, that's a great answer. One more question for Dr. Williams, then we're going to do a little writing exercise together, okay? So this is a question also from Victor Valley High School. Betzaida Orozco Salazar, I hope I pronounced that correctly. She said, if you can't afford a private education, expensive schools, can you still become a doctor? Can you still make it?
100%. 100%. I have nothing but love for the path that I took. I mean, I loved being at Northwestern and Stanford and Harvard, and it was great. But, if I were to go back now and go, maybe I should have thought more a little bit about the debt that I would be in by going to those schools. You can go to a state school. You can go to, a community college and start your education there. And that is not a bad decision. You can still end up being a perfectly successful, competent physician. by
Thank
starting
you.
off at those places.
Mr. Fermil, any thoughts on that too? Like say, oh, well, I could never afford to work in this field. I should just go do something else. What do you say to that?
Yeah, I don't think that money should ever deter you from pursuing something that you want to do. There's a lot of grants and funds out there that can help people out. And furthermore, even if you just go a route where you're getting student loans from the federal government, I work with a lot of physicians who are in a lot of debt and have several years to pay them off. But the amount of money that you make can allows them to still have a great lifestyle and do exactly what they want to do and pay off their debt at the same time.
Thank you. Thank you for that. Oh, we'll take our guests, stay with us. We're just going to take a quick pause, and I want to do a writing exercise with the students. We always try to add one at the end because we want to teach students the value of being a good communicator when you're looking for opportunities and as you're communicating in a job. Okay, they matter both. I'm going to take you to a worksheet from inside of our Emerge curriculum. And teachers, show of hands, how many students message you with lowercase letters? All the time, lowercase letters, not all the time, punctuation, looking like text messages, right? This is where we are. It's where the world has become, but we have to clean it up when we're communicating for opportunities. Now, what I want you all to do, and I'm gonna get my chat up and so I can see, this is a sample email with lots of lowercase letters, right? I would like the students, if you're at your computer, please, the line that I just highlighted, I would like for you to write that sentence for me as a complete sentence. I'm not going to tell you any more than that. You tell me what a complete sentence should contain. And I want you to rewrite this line for me and show us in the chat that you know what a complete sentence is. So when you're sending an email for an internship, a job shadow, a scholarship, whatever it is, that you're remembering that these little things matter. And I want to get our guest to sound off on that, but I'll give you a second to provide me an answer. Thank you to Elise Cronin. Because writing, we say we should not judge people. Don't judge a book by its cover, right? We say don't do that, but do we do that if all we know is how the person has written to us? Is that how we're going to judge them? That's unfortunately how it goes. Thank you all for rewriting this sentence, showing all of us that you know that when it's time to be professional and go after an opportunity, your writing has to take a notch, take a step up. Let me ask our guests, and we don't want to use all capital letters. Okay, that's not what we want to see. That's like you're yelling at the person. Let me ask our guests as we head for home. Dr. Williams, if you receive an email from someone who wants to work with you or work under you, and it's all lowercase and there's no punctuation, it's all one paragraph, no breaks, what does that say to you versus if it's well written?
Actually, in actuality, to me, it probably says it's a spam message. And so I will probably delete it or send it to my spam folder.
Wow,
I will not even
just like that.
Yeah.
It's gone. It never even happened.
Mm-hmm.
Mr. Fermil, if you're looking to bring somebody on, hire someone, or seek anything, any opportunity from someone, does their writing matter? How they communicate matter?
Yeah, I think to piggyback off of what you were saying about not judging a book by its cover, and I learned this in public speaking in high school, but 80% of what you know or what you feel about somebody is within the first 15 seconds of meeting them. And if it's an email, then that's the first 15 seconds. That's going to speak volumes. So if you can look up even changing some words by just clicking for synonyms and things of that nature and correcting your punctuation, it makes a huge difference.
Thank you for that. Students, raise your hand if you understand that even though we're talking about medicine today, doctor, nurse, medicine, healthcare, does writing still matter? Especially if you're writing notes to your team, you're messaging a patient or a family. How you communicate is how if people are going to take you seriously or not. And so I appreciate we all went through that little exercise. Teachers, feel free to continue to press students on these little things because they hold so much significance. As we wrap up, I want to reiterate what I mentioned at the very beginning, and then we will wrap up with our guests. So those who missed this at the beginning, we put together a Google Drive folder for free of email etiquette lessons, email address creation, not sending text messages, subject lines, all these things that we mentioned. And we've been touching on a little bit here and there, all in a Google Drive folder for you, your class, and you can share it with any other teachers in the building. Also, an online presentation checklist of some simple ways to make sure that your presentation, it looks the best it can. If you missed this at the beginning and you'd like these resources, this is for educators, okay, not the students, just educators in the chat now. Type interested and your email address. And if you're new to the Reuben community, you don't have these resources yet, ideally, we want to have a 5-minute phone call with you to say hello, pass it along, make sure that you can make the most of it for your students. So those who requested it and you're new to us, you will see a Google invitation or a calendar invite later today. And if the time has not worked, just request another time. Okay, but just look out for that in the next few hours. So just be aware that it's coming your way. Also, please join us in 2 weeks for our next session on the world of being a chef with a gentleman who was a 2-time contestant on Hell's Kitchen with Gordon Ramsay on Fox. So he's an executive chef in Michigan. So really cool conversation there. And finally, if you missed our live session today and you're watching on a recording and you want those free resources, email us here and we'll pass it along that way. Okay, so let me hop back out of here. We'll give our guests some parting words. I'll start with Dr. Williams. You have a lot of students here who they haven't yet begun the journey, right? They're still in high school, many of them, and they're just excited to get going. What is your best advice as they begin on their medical path?
Well, I would say make sure that this is something that you really want to do. You have to want to do this. This isn't a place where you're going to get rich. You know, doctors can make good money, but if you want to be rich, you want to go do something different. That's not the reason to do this. You want to do this because you're interested in health. You're interested in, this is colloquial, but you're interested in helping people. And that really is the be all and it all. That's the reason I get up in the morning and go to work every day, and I'm happy to be there.
Love it.
So, yeah.
Thank you. Mr. Fermil, what's your response there?
Yes, I would say that even through the burnout, I'm going to agree with Dr. Williams that I still drive to work every day knowing that I'm going to be exhausted, but just thrilled to learn something new. There's something to learn every single day. I've been in that department for 5 years, and every day I learn something different, and I get to make a hard time in someone's life a little bit easier. So just go into it knowing that you're going to make a difference. And I did want to mention as well that there's always the opportunity to shadow. Even if you're still in high school or just getting into college, I would highly recommend reaching out to your local emergency department or your pediatric neurologist and seeing if you could come shadow for a day. It's hard right now because of COVID, but as we kind of come out of that in the next year or two, hopefully, I think that would be a huge benefit.
Well, and I think that wraps a ribbon around this, because if you want to shadow, what do you have to do? You got to send one of you or your supervisor an email, right? Or you have to call, or you have to walk in, and that requires communication skills. So once again, right before you even start medical school or nursing school and you want to shadow, it requires learning how to approach people so they'll take you seriously. It's a great suggestion, Mr. Fermil, to start to shadow to see if you really like it. And when it's time to put yourself out there, remember that writing lesson that we did today. I want to thank our special guests. Can we have some Zoom hands for our guests to say thank you? Some hands go up. It's that you can just imagine they're all applauding you. Okay. You can't hear them, but they are all over the country, because I thought, don't you think, show of hands, they gave you some really honest advice today? That's what we want in these sessions, is authentic advice, real, help you really understand what goes on in that job and in both jobs today. So I want to thank them both for being here. I hope, and thank you to Ms. Colwell for keeping up with us in our conversation. And I hope that you'll join us in 2 weeks for culinary arts conversation and dealing with Gordon Ramsay as he yelled at our guests, telling him he's a terrible chef, even though he's probably very good. So again, thank you for being here. And I hope we'll see you in a couple weeks. Best of luck wherever you are in school, and have a great rest of your day. Thank you again.
Thank you.
Thank you.